question was, which enterovirus causes acute hemorrhagic conjunctivitis? Your options were strain 68, strain 69, strain 70 and strain 71. So answer here should be strain 70. Now this question you have to just remember. Can you just see in this picture, if you can see there is a hyperemia there, okay, so the redness you can see. This is not particular a subconjunctival hemorrhage, though it looks like that. So how to differentiate in subconjunctival hemorrhage? You would not be able to see the vessels. So blood vessels won't be seen. But in normally the acute hemorrhagic conjunctivitis in initial stages, you can identify that there is a engorged and dilated blood vessels in the conjunctiva and subconjunctival region. So this is how you can basically differentiate between a conjunctivitis and a subconjunctival hemorrhage. Though in late stages of hemorrhagic conjunctivitis, you can get a total subconjunctival hemorrhage also if these vessels bleed. So some important points that you should remember regarding acute hemorrhagic conjunctivitis is that the most common organisms that cause it are enterovirus 70 and Coxsackie 24. So these two you definitely have to remember. The features, as I told you earlier, as hyperemia. Very important is acute onset. One question that AIIMS asked you was that there was a village and there is a sudden onset of the hemorrhagic conjunctivitis in a whole community. So, what is your potential organism? So, remember, if there is a sudden onset of redness in whole community, then it can be a hemorrhagic conjunctivitis, because other causes, causes of red eye like uveitis or trauma, they cannot be in whole community only. Then in these cases you get a follicular hyperplasia. When this conjunctivitis was discovered, the Apollo mission for moon was also going on. So another term that is used in US is Apollo conjunctivitis for this type of conjunctivitis. As I earlier told you, very short incubation period. So if one person in the family is having it, within 2 or 3 days, you can see the redness in the other member of the family also. The best thing is it is self-limiting. Nothing has to be done. Take regular care of eye and use lubricants if you want, and it would be over in few weeks time. Important thing that you have to remember in its management is that you have to tell the patient that it's highly contagious, and you can get it from the patient's clothes, and if try don't touching the patient, or if there is a small baby in the house, tell the baby to be out of reach for that person who is having the conjunctivitis. So these are some important points regarding acute hemorrhagic conjunctivitis.